Today we are going to start with gynec lecture, and we had seen about normal menstruation, physiology of menstruation and menstrual disorders in previous sessions. Now in this lecture we will see about menstrual disorder that is called as amenorrhea. Amenorrhea is a term that means there is absence of menstruation. Absence of menstruation is called as amenorrhea. Now amenorrhea is as we know, it is absence of menstruation. There are two types or two main causes of amenorrhea, that is physiological and pathological. Physiological amenorrhea is absence of menstruation in normal situations, like physiological absence of menstruation we will see during pregnancy. As we know, there is during pregnancy there is formation of fetus, embryo starts to grow, and there is absence of menstruation. Secondly, it is seen in pre-pubertal age. Before puberty, there may be amenorrhea. Next, we can see in menopausal age, that is post-menopausal amenorrhea, and we can see amenorrhea during lactation, during breastfeeding. We can see absence of menstruation. So these are conditions where there is absence of menstruation and it is natural. There is no pathological or any structural, hormonal or any other cause. It is natural thing. There is absence of menstruation. So pre-pubertal, pregnancy, lactation and menopausal. These are four things where there is absence of menstruation. Now these are physiological things, and now we are going to see pathological reasons for amenorrhea. Pathological reasons for amenorrhea are primary and secondary. Primary amenorrhea and secondary amenorrhea. So in primary amenorrhea, it means failure of menstruation by the age of 13 to 14, where secondary sexual characters are not developed, or absence of menstruation by the age of 16, where secondary sexual characteristics are well developed. That is called as primary amenorrhea. Okay. Now we will see about secondary amenorrhea, that is failure of menstruation. That means menstruation has been started but it has been stopped for 3 to 6 months. That is secondary amenorrhea. So primary amenorrhea and secondary amenorrhea, these are the main causes for pathological amenorrhea. We had discussed about physiological amenorrhea. Those were natural things or natural circumstances where menstruation doesn't occur. That is pre-pubertal, pregnancy, lactation, menopausal. Now in pathological reasons, we have two types, primary and secondary. Primary amenorrhea is failure of menstruation in that girl, that means menses has not occurred by the age of 13 to 14, where secondary sexual characters are breast development, pubic axillary hair development and other things, they are not developed, or secondary sexual characters are developed but menses has not occurred by the age of 16. That is primary amenorrhea. Primary, you can understand, it is absence of menstruation. In that girl, menses has not been occurred by the age of 16. Normally we see in puberty menses start usually by the age of 13 to 14 in every girl. But in some girls, menses doesn't start, and that we called as primary amenorrhea. Secondary amenorrhea is amenorrhea, that means it is absence of menstruation. That female have her normal menstrual cycle before that, but she will give history that from 3 to 6 months she does not have menstrual cycle. That is called as secondary. Secondary means she was regular on her cycles but now menses has been stopped. Primary means absolute absence. Secondary means absent from some duration, some time, some months. These are two types, pathological types of amenorrhea, primary and secondary. Now we will see in detail about, first of all, primary amenorrhea. Now in primary amenorrhea, is absence of menstruation by the age of 13 to 14, where secondary sexual characters are not developed. When these secondary sexual characteristics are not developed, that means there is delayed development in her sexual characters. So maybe there is absence of menstruation. So the reasons are usually delayed development, maybe retardation, maybe growth retardation, maybe some nutritional problems because of low weight, excessive weight, maybe because of anemia, because of some psychological factors, maybe because of some drug history, medicinal history, patient with long duration with some steroids or any analgesic drugs, patient with major disease like renal disease, heart disease, or any type of disease. Congenital diseases are seen in some girls. So these are the things, these are the causes for primary amenorrhea without development of secondary sexual characters. With proper development of sexual characters, there are the causes that there is usually secondary sexual characters are seen, that girl is perfectly developed, but causes may be non-functioning uterus, absent vagina, non-functioning ovaries, or improper developed ovaries, or absent ovaries, absent uterus, imperforated hymen, septum, vaginal septum, any growth, tumor, cyst, then tumor of pituitary gland, hypothalamus dysgenesis, ovarian dysgenesis. These are different causes where secondary sexual characters are normal, but these are genital causes mainly associated with her amenorrhea. Commonly it is non-functioning uterus or absence of vagina, absence of ovaries or not developed ovaries, or hypothalamic pituitary problems usually seen with secondary sexual characters are developed, though she is normal but she doesn't have her normal menstruation. If secondary sexual characteristics are not developed by the age of 16 also, we can see for any intersexual conditions, like that girl is not perfectly female, maybe there is development of some male sexual organs in her genital system. So intersexuality, Turner syndrome or Klinefelter syndrome or genetic, many syndromes are associated with that. So whenever there is no development of secondary sexual characters, her breast development is not proper, her usually other characteristics are not seen, then there may be intersexuality and there is absence of menstruation. So these are causes for primary amenorrhea. So just to revise, primary amenorrhea, whenever there is proper sexual characters, we have some anatomical reasons, that is absence of organs or non-functioning genital organs, some tumor, cyst, nutritional problems, obesity, excessive weight or very low weight, some history of drugs, medical other conditions, and rarely it is associated with family history. And when secondary sexual characters are not developed, maybe it is suggestive of intersexuality or any genetic disorders, or sometimes it is retardation or congenital diseases. That is about primary amenorrhea. In short, we have this primary amenorrhea causes in detail and added some slides after this lecture. You just go through it. Now we'll come across secondary amenorrhea. That is secondary amenorrhea means patient have normal menstrual cycle, but there is history of absence from 3 to 6 months or more than that. That is secondary amenorrhea. Now in secondary amenorrhea, usually it is because of some causes or reasons, and the causes for secondary amenorrhea are mainly it is because of inflammatory focus, mass, any cyst, tumor, because of intrauterine contraceptive device, then PCOS, that is polycystic ovarian disease, because of radiation, if patient is taking some radiotherapy, chemotherapy for cancer, that may lead to secondary amenorrhea. If patient is on steroids, if patient is on hormonal treatment, if patient is with some major disease, treatment of major disease after any surgery, after major operation, genital surgery as well as abdominal surgery, and as well as some nervous problem, psychological reasons. Some patient may have history of burn or injury, genital injuries, that may lead to secondary amenorrhea. Other causes are maybe patient with psychological factors, as we discussed. Some patient may have sudden grief, shock, and menses stop after that. Nutritional problem we discussed, if there is very low HB, patient is anemic and there is failure of menstruation. So these are some causes for secondary amenorrhea. There is one term in secondary amenorrhea, that is cryptomenorrhea. Cryptomenorrhea means there is presence of menstruation without external bleeding. Patient have menstrual cycle on particular day or per month cycle is there, but there is no external bleeding. That is called as cryptomenorrhea. Cryptomenorrhea is congenital as well as it is acquired. Congenital cryptomenorrhea is because of imperforated hymen, transverse vaginal septum, or any abnormal growth in uterus, that is congenital. And acquired is because of some problems like major surgery, accident, injury, trauma, or burn, or any obstruction in her genital cavity because of tubercular focus or any large mass is obstructed, and that leads to cryptomenorrhea. In cryptomenorrhea, patient have menstrual cycle, but the menstrual fluid is collected in the uterus because of some obstruction. There is no external bleeding. That is called as cryptomenorrhea. And clinical features are patient have particular pain on particular those days of month. She will complain of pain in abdomen. She will have crampy sensation, backache, lower abdominal pain, sometimes vomiting, weakness, fatigue, all associated complaints. On examination, we can see general examination is usually normal, but we can see palpate her abdomen. There is growth can be seen. Uterus is abnormally enlarged. Size of uterus is enlarged, and there is tenderness on touch. PSPV examination, if we have to do it by a very careful manner, because there is collection of blood in the genital cavity. So we have to just see by per speculum examination, and by doing this PS examination we can see the hematoma like condition or blood collection or a balloon filled up with that menstrual fluid is seen on the per speculum examination. And for treatment, before that we have to do investigation, basic routine investigation with USG, and on this USG we can see there is collection of blood in the uterus. Treatment, we have to remove that collection, menstrual collection, and this can be done with general anesthesia. It is a surgical procedure where we give anesthesia to patient and we rupture the balloon under proper precaution, and menstrual fluid is removed out. And after that careful observation, she is kept under our treatment, and 3 to 6 months hormonal treatment is advised. That is a term cryptomenorrhea. It is a type of amenorrhea, secondary amenorrhea. So we revise secondary amenorrhea, that is absence of menstruation for 3 to 6 months. Before that menstrual cycles are regular. Causes are radiational history, medicinal history, history of accident, injury, trauma, burn, then history of medicines like steroids, prolonged history of steroids, hormones, all these things are copper T, all these things leads to secondary amenorrhea. Now clinical features are, important clinical feature is, in primary amenorrhea that girl will tell that there is no menstruation, absence of menstruation, and in secondary amenorrhea she will give history, there were normal menstrual cycle but from 3 to 6 months absence of menstruation. And depending on the conditions as we discussed, if it is seen in young girls, if it is seen in other females, complaints are like that. Basic complaint is absence of menstruation. Other associated complaints we can see according to cause. And investigation part, we have to do all the routine things, blood investigation, we have to do hormonal assessment for primary amenorrhea basically, because it is a question of that young girl. So we have to do FSH, LH level, estrogen, progesterone level, thyroid level, because thyroid hormones are very important. So all the assessment of hormones we have to do in primary amenorrhea. Also we have to do her sonography as well as, if needed, genetic study. If secondary sexuals are not developed, we have to go for detailed type of karyotyping or genetic study. If intersexual conditions are seen, we have to go for cosmetic surgery. If that girl is having some male organs or like that, we have to go for cosmetic surgery, plastic surgery. That is about primary amenorrhea. Secondary amenorrhea, as compared to primary amenorrhea, it is a simple thing to treat because it is some cause or some reason is there that leads to menstrual absence. And the causes are usually inflammatory causes or accidental injury or contraceptions, or maybe PCOS, polycystic ovarian disease. That means there may be cyst or tumor. So we have to treat that secondary amenorrhea according to that cause. That means if there is inflammation, we have to remove that inflammatory focus by giving antibiotic, analgesics. If there is cyst or tumor, we have to remove that If patient have history of some medicines, we have to stop that medicine. If patient is because of having this amenorrhea because of radiation, after some time of that radiation treatment, her menses will be normal. So secondary amenorrhea is simple to treat as compared to primary amenorrhea. Cryptomenorrhea, as we discussed, it is a surgical thing. We have to do her surgical procedure. So all these things are under amenorrhea. So amenorrhea is a topic which is simple to listen, but it is difficult to write. So you just go through the causes of amenorrhea. All the other causes are mentioned in your books. As I told you, just superficial causes, just to remember it easily. Primary amenorrhea and secondary amenorrhea. Go through the slides for details. As simple thing, amenorrhea is the menstrual disorder where there is absence of menstruation. Primary physiological is normal things like pregnancy, lactation, prepubertal and menopausal. Pathological, primary and secondary. Primary means does not occur, menses does not occur at all, and secondary means history of menstruation but absence of menstruation. In primary, with well developed sexual characters, with absence of sexual characters. If well developed sexual characters, there may be anatomical defect, obstruction, or some other diseases, thyroid diseases, pituitary diseases, or improper development of organ. And if secondary sexuals are not developed, then maybe some genetic diseases or tumor like condition, congenital abnormalities, or intersexuality. Secondary sexuals are, secondary amenorrhea is absence of menstruation because of some reason. Major reasons are PCOS, accident, injury, trauma, surgery, medicinal history, radiational history, burn. These are the things which can lead to secondary amenorrhea. Clinical features are absence of menstruation. That is the main thing a patient will complain of. Okay, there is absence of menstruation. And because of this, we do the investigations, or we have the examination part. In the examination, usually there is, we can find in amenorrhea, primary amenorrhea, the girls have secondary sexual characters developed or not developed, two categories. If developed, we do the investigation accordingly. If not developed, we do the genetic study and all. Secondary amenorrhea, we directly go for routine test and USG laparoscopy and remove the cause. So this is the amenorrhea. Now in this topic, we have many syndromes like Turner's syndromes, Klinefelter syndrome, Cherry-Formel syndromes, Rokitansky syndromes. Different syndromes are there. So you just go through the amenorrhea and find out the different causes of amenorrhea, especially in primary amenorrhea. There are different types of syndromes. Just go through it and find out the names of that syndrome along with the condition, underlying condition. And importantly, again, it is a homeopathic condition to be treated, because in proper or allopathic treatment, they just go for hormonal treatment. They just give hormonal treatment for 3 to 6 months and observe it, or more than that, 1 to 2 years also. Primary amenorrhea, it can be treated with hormones, but homeopathic remedies do very well in primary amenorrhea as well as in secondary amenorrhea. Primary amenorrhea, we have homeopathic remedies which look like, like because of the improper development of organs, or if there is no genetic reason, if organs are proper, if there is no anatomical thing, like there is no obstruction or anything, homeopathic remedies can do wonder, because otherwise that girl should be on hormonal treatment and other side effects of hormone can be seen. So homeopathic remedies for primary amenorrhea as well as secondary amenorrhea. So that was about amenorrhea. Just go through it and properly read about amenorrhea.